about the next generation select all but apply questions. First off, partial credit is possible, which is great since there can be around 10 answer choices. And secondly, these new extended multiple response questions can come in a variety of formats. Let's go over 3 different types. For the select N type, you could be looking at 10 correct actions, and you might have to choose which 3 to do first. For this type, the true-false method for answering a static question will not work. In the grouping type, the answer choices can be categorized. This question might say, which orders does the nurse anticipate? And the groups might be a list of possible activity orders, a list of medication orders, and a list of parameters to monitor. Then, there is the normal select all but apply style question. This one doesn't tell you how many to choose and doesn't group the choices in any way. But remember, partial credit. Let's take a look at one of these. This question comes from the My Mastery Nursing app. It says, based on the nurse's note at 1500, which actions does the nurse perform? This question occurs in the middle of a case study. We've already gotten enough clinical cues and data to know that this child has increased intracranial pressure. She's in pain, morphine has been given, and the nurse performs some non-pharmacological measures. The note says she is vomited, is lethargic, and has some classic symptoms of Cushing's triad. The nurse makes an educated guess, or hypothesis, that her intracranial pressure is now an emergency. The nurse has to take action. If you know that you like to read into questions or sometimes miss important information, you'll really want to pay attention here. Note that the question doesn't ask what actions are most important, just which actions the nurse will do. The nurse has to recognize that the clinical picture, the patient's symptoms or cues do not have anything to do with giving morphine, so Narcan isn't needed, and that she is too unstable to delegate vitals. All of the other actions make sense and should be done sooner rather than later. So now you can see that these questions are a mix of knowledge and strategic reading. So when you encounter a static question, slow down to read the question and really understand what it's asking you to do. Now, if you're ready to start